I'm very excited to bring in one of the senior people at our Center for Human Factors Institute, Dr. Ratwani, who you've got his bio in your package. You could see the extensive background and PhD work he has in the field of human factors and the number of awards and publications he's done. But Raj and I talked, and I think his message this morning that he will share with you will tie in perfectly with a lot of the things Paul left you with at the end, as well as some of the discussion we had around the value of not only those harm events and doing the right thing and learning from them, but the abundance of near misses, unsafe conditions, the environments we work in that sometimes we just accept versus raising our hand and saying, we need to improve this because if we don't, somebody's going to get harmed. So with that, Raj, I'll bring you up here and take us away.
Thank you, Dave. I appreciate it. So as I was starting to put this talk together, I realized that several folks may not be completely familiar with human factors and what our center does. So I thought I'd spend just a slide talking about what exactly human factors is and a little bit of background on myself and my approach to the science. So for those of you that are not familiar with human factors, the overarching objective is for us as scientists to understand human capabilities and to apply that knowledge to our work environments, and specifically to apply that to technology, to devices, to any artifacts that we work with, ensuring that those capabilities match what we actually have to do. Okay? And it's by nature a multidisciplinary science. We borrow from psychology, cognitive science, industrial engineering, biomechanics, to name a few. There's several other in there, but these are, I think, some of the top ones. And my background is really in the psychology and cognitive science space. So I've spent a lot of time thinking about the way we think, how we reason, how memory and perception affects our behavior. So that's kind of my sweet spot, and that's what I'm going to share with you today. And if we look at how the domains that have relied on human factors, there's, I think, 4 primary areas. And the science was really born out of aviation and defense, has now expanded to other areas in transportation. Nuclear energy is a big area where there's been a tremendous focus on human factors. And now we're starting to see this finally come over to medicine. And my kind of history has been in the defense industry. I've spent about 5 or 6 years working at the Naval Research Laboratory with organizations like DARPA, and about 6 months ago came over to work with Terry's group. And it's been an incredible 6 months. It's something I wish I would have done earlier, and for me it's a whole new exciting field. So this is kind of my background. And what I want to do today is I want to share sort of my perspective on errors and the way that we've thought about this on the Navy side, and how we can change the way that we think about this when it comes to medicine. So that's kind of my overarching objective. Now, I want to start with a little bit of audience participation here. So how many of you have left your keys in your car before?
Oh, and many of them.
Pretty much everyone here, right? And how many times have you gotten in and out of your car before?
Too many.
Way too many. Thousands of times probably, right? But we still occasionally make that error. All of us, if someone said, are you an expert at getting out of your car? I think all of us would say, yes, I can do that pretty much flawlessly all the time. Yet occasionally we still make an error here or there, right? The message here is, how many times have we done these tasks before? Usually it's thousands of times, sometimes hundreds of times. We're all generally accurate here, but occasionally there's this kind of slip or lapse and we make a mistake. And if we look at how human factors folks think about errors, we generally break them up into 3 distinct categories. So one of those is looking at the knowledge-based level. And this is generally under very new situations or novel situations. It's where we don't quite have the right knowledge of how to perform a particular task. So really you're performing the wrong step because you just don't have the knowledge. So it's kind of this trial and error example. And if you think about the way we learn, for most tasks we start out here. So think about riding your bike. You kind of go through some of this, you're going to fall a lot, but you finally get it, and you move beyond this stage. Generally in medicine, for experts, we don't have a problem with knowledge-based stuff. And when we do, we can handle it. The next stage is sort of rule-based, and this is slightly more familiar situations that we've been through, but the knowledge is not quite solidified. Right? And so errors that you see here are generally things where you perform the wrong step because you misapply a particular rule. Right? Generally, we don't see these kinds of errors in medicine either. And when we do, we can handle them quite well. And the last stage is this area of skill-based errors. So the errors that we just talked about on that last slide, leaving your keys in your car, forgetting to put the keys in the right location, things like that, forgetting to take your medication, generally fall in the skill-based zone. And the skill-based term is a bit inappropriate when we talk to medicine because people generally think about, well, actual motoric skills, surgical skills, right? That's not what we're talking about at all. What we're talking about here is performing the wrong step because of a blip in cognition, right? A slip or a lapse. You forgot something this one particular time. And the base rate of these errors is actually quite low when you look at it. When you look at just sort of performance in a vacuum, how often does this error happen? Less than 5% of the time, generally 1 to 3% of the time. But we know that in medicine, that's still pretty costly, right? You don't want 1 to 3% of errors, right? We talk about these different error rates, and that's not where we want to get. And I just want to pinpoint and sort of dive into these particular skill-based errors a bit more. So in our group, we start talking about these as automaticity errors, because that's really what they are. You're sort of in this automatic mode. You've done these tasks hundreds and hundreds of times before, and you'll occasionally make this slip or lapse. If you look at when they happen, it's very hard to predict exactly when they're going to happen. We do know that, again, it's thousands of hours of experience that people have on these tasks, and they're still making errors. And they can occur on simple tasks like making coffee, which most of us do every day in some fashion or another, but also in complex tasks, so surgical tasks, flying an airplane. I mean, name any complex task that most of us know well, you're still going to occasionally have an error. And one of the things I did at the Naval Research Laboratory was I spent a lot of time looking at the domains in which these errors happen and how those errors account for accidents or incidents. Okay? And I spent a lot of time looking at National Transportation Safety Board reports and looking at, particularly again for transportation, looking at train accidents and looking at car accidents and aviation accidents. And what you can do is you can start to compile all of these error rates, and it's pretty amazing to see what you actually get when you do that. So I think I have a laser pointer here. So what this graph here is showing you is that of all the accidents or incidents that happen, how many of those are at least partially attributed to a skill-based error? It's pretty amazing. If you look at aviation, military, 50% of accidents can be attributed to skill-based errors. Not that you put in a pilot that doesn't know how to fly, it's because they make some sort of blip or have a blip in cognition, and this is what you get. Commercial, 60.5%, aviation, 48%, aviation maintenance, 48%, mining, 60%. The one medical study I could find is intensive care out of Australia, I believe, 53%, railway, 63%. So you kind of see what I'm getting at here. This is the real problem. This is where we need to be focusing on, are these skill-based types of errors. If we go back to my little graphic of the three different distinct types of error groups, most of this can be handled by training, and we're good at doing that. These cannot. We're not going to prevent these by training. We're not going to prevent them by policy. We're not going to prevent them by discipline. They're going to happen. So let's talk about what we can actually do about that. So the actual approaches to dealing with errors, traditionally what we do is we're very person-centric, right? You make a mistake, you get out of your car and you forgot your keys, you're in trouble, I'm taking your license away, get in and out 50 times until you know that you need to take your keys. Well, that's still not going to work, right? You're still going to be rushing one day and you're going to forget and you're going to leave your keys in the car. So we kind of see that this particular approach may not be the most effective. Now, I'm not saying that if there's an egregious error, if there's a blatant violation, yes, you have to do something about it, and training is required, and discipline is required. But as we just saw from the last table that I showed you, the majority of these errors are skill-based, and so this approach is not going to work. An alternative is the systems approach, and Dave has done a tremendous job of bringing in folks that have talked about this approach in one way or another. So when we talk about high reliability organizations, what we're talking about is really applying a systems approach. And I think it was in the last session or the session before that when we had the great talk on high reliability organizations. And one of the things I wanted to do today was demonstrate how we can actually do that, right? What are some concrete steps, particularly from a human factors perspective, about how we can move towards that direction? And that's what I'm gonna push on a little bit. And the idea is that we really need to focus on the conditions under which errors occur. We need to build defenses, and we need to work to avert errors and avert harm. That's the key thing we need to focus on. So for today, the first part of my talk, I'm going to focus on very, very briefly. I'm going to try and convince you that no matter how capable we all are, and all of us in this room and most of us in general are extremely capable individuals, errors are still going to happen. And that if we take the systems approach, we can begin to address this. And what I'm going to do is I'm going to demonstrate how we can focus on people and the interaction with the environment to design to avert errors. We can develop systems, more robust systems that are more error tolerant, where we can reduce harm. And then finally, I'm going to talk about how, very, very briefly, how we can take some organizational steps and how a lot of the things that Dave are doing are exactly in the right direction and how we can leverage that. Okay, so that's sort of the roadmap for today. So let's talk a minute about our work conditions, and Paul touched upon this briefly, is that all of us come to work with the right intentions. All of us want to do a good job when we come into our positions. We all have the best intentions when we go to work. But the reality is that there's several other environmental factors that can make it so that there's variability in our cognition. There's variability in our performance, and on top of that, within the system, there are a lot of complexities. There's a lot of difficulties. And so we're never going to be a steady stream of cognition. We're never going to be able to always be at our 100% level. There are going to be things in the environment, there are outside factors that really, really push this around. For me, I have a 7-month-old at home. Just, I think, about a month and a half ago did she actually start sleeping about 10 hours a day. So prior to that, it was waking up every 3 or 4 hours. My wife also works, so we're kind of negotiating on who's going to get up on what particular days. So I can tell you that I was going to work every single morning tired. That's just part of it, right? We just have to accept that. Most of us have some kind of conditions like that that are going on. So the key here is how do we build a system to make it so that we can absorb that fatigue, we can absorb that kind of variability, and actually be robust. And particularly here, I'm going to show you some data on interruptions, on workload, and fatigue. And I have to say from the outset that the relationship between all of these variables and the kinds of errors that we make and the shift in error rates is very, very difficult to find. So we've ended up running a lot of these studies ourselves. So the history of error research, errors have been studied for 50, 60, 100 years. The majority of that research work is focused on error taxonomies, classifying errors. And part of the challenge there was getting data. So a lot of times scientists would sit there and they'd wait for an incident to happen. And they'd say, let's look at that incident and try and classify it and push forward. Only within the last 10 years have we found good cognitive theories to account for these errors, and have we started to replicate some of these error rates. So I'm going to show you, I'm going to walk through on the next 4 or 5 slides a whole host of studies that show what these conditions can do to our error rates. All right, so a few caveats on this. One is they're studies that are primarily with undergraduate students, primarily because that's all we can actually do to collect this data, right? No hospital is going to say, or maybe now they'll start to say, come and do some of these deep analyses so that we can figure out the influence of these effects on error rates. The second piece to use psychology students is, and I come from a psychology department, is we can almost do anything that we want to them within IRB requirements, right? So if I need to run them for 20 hours on a particular task, I can do that and I can get lots of great data, all right? So the caveat is that these are all laboratory-based. Ultimately, we don't have a lot of information here, but this is going to shed some light on what some of these effects can do to us. All right, so everybody ready for a little bit of data? So let's talk about interruptions and how disruptive they can be. Here I have a control condition, which is on the left, which is a case where people are doing a particular procedural task, a task that they know really well. They're doing that uninterrupted, and another case where we start to interrupt them very, very often. When we do that, we move from about a 1% error rate, like I was talking about, these are all skill-based errors, to a 10% error rate, right? So a quick 10-fold increase simply by interrupting our performance. Detrimental, if you think about this, right, to what's happening to our cognitive systems. Let's talk about other work we've done with errors. We've actually run several conditions where we vary the length of the interruption, right? And there's deep memory theories that account for this finding, which I'll touch upon later on. I think all of us are pretty familiar with the fact that the more time that passes, the more likely we are to forget something. So if we actually vary the length of the interruption when we interrupt people, you kind of see what happens. Again, a control case of about 1 or 2%, up to 30 or 35% if we interrupt you for a minute. So we take you away from your task for a minute, we distract you and have you do something else, you come back, there's a 30% chance you're going to make an error. That's incredible. So if we look at this, a 10 to 30-fold increase simply by interrupting people during their tasks for a long duration of time. If you're ever having a conversation with someone and you really want to get them irritated, continue to interrupt them as you're talking to them. It'll drive them nuts. I purposely do it to my wife sometimes, and it's a mess. Let's talk about workload and error rates. So down here on the x-axis, what this group did here was they tested people's working memory load. They split folks from low capacity memory loads and high capacity memory loads. and then they had them perform these tasks, and they varied the memory load that folks had to carry with them, right? And what you find is that you're about 1.5, sometimes for the high capacity folks with no load, you're about 2.5, 3%, but you can see this significant increase in error rates when you actually start to change the working load that people have. So think about this in your environment. You have a particular task to do, and you're trying to juggle 8 to 10 other things as you're doing that task. Right? How's that going to change error rates? Here we're seeing about a 5-fold increase if you really focus on the folks that have low capacity working memory loads. So a big shift there. And this here is one of my favorite graphs that I've pulled from work on airline maintenance. So we're going to take a quick second to digest it. So the solid line here, and the two solid lines on this graph is a bit confusing, but the solid line up here represents skill-based error rates, and on the x-axis you have the time of day. So they're looking at circadian rhythms and error rates. The first thing to notice is that the skill-based error rates always outnumber the other two error types, the rule-based and knowledge-based, right? Across these high-risk domains, we're doing a good job of keeping the untrained folks, the people that don't have the knowledge, out of these systems. That's the right thing to do. We're not doing a good job of accounting for these skill-based errors. And critically, if you look at what happens between, about 1 and 4 or 5 in the morning, you get this massive spike in the number of skill-based errors, right? Absolutely incredible spike. And we're doing really well at about 6 or 7 o'clock. That's sort of the prime time, dinner time. So this is pretty staggering, I think, and 3 to 4-fold increase from the worst to the best cases here. So I'm hoping that folks kind of get the picture of what I'm trying to say here, is that none of us are resistant to the influence of interruptions. None of us are resistant to workload or fatigue. I don't care how much coffee you drink. I don't care how much Red Bull you drink. I don't care how much 5-hour energy or next fancy drink, infinite energy is what I'm waiting for, that's going to come out. You're always going to run into these kinds of problems. And what we really need to do is start to begin to accept that there's going to be this natural variability in our performance, and we need to plan accordingly. That's the heart of being a robust organization. It's planning accordingly and designing for it and making sure that we have systems in place. All right? I think we've heard that message a few times, and so what I want to do is I want to show you a couple of concrete examples of what we can do from a human factors perspective and how we can start to sort of help our organization move towards this. So I know people like checklists, so I think I've convinced people that errors, hopefully people are convinced that errors are going to happen. We're going to check that one off. And my next goal is that the systems approach needs to be our focus, okay? And so what do I mean exactly? Well, like I said, I'm going to talk about 3 things. The first one is that we need to make it easy to do the right thing. This comes straight out of an IOM report, right? Make it easy to do the right thing. So given all of those conditions I just talked about, the fact that we're fatigued, high workload, and so forth, let's make it easy. To do that, I'm going to focus on a single case where we can design for error. So if we do the right analyses and we look at particular devices and tasks, we can actually design for these particular errors, change the way that the device actually works, and we can hopefully lower the error rate. I'm going to show you a concrete example of it. The second thing is this idea of building robust systems. And here we're going to do a deep dive into some health IT research that our center is doing. All right, we're going to get kind of way into the weeds here. It'll be a test of people's ability to resist fatigue as we get into all these details, I think. And then finally, I'm just going to have a slide or two on how we can act as an organization to identify areas of risk. And much of it is going to follow from the conversations we just had following Paul's great talk. So how do we actually design for error when we talk about devices that all of us interact with every single day? So one of the things is we need to really study the environment and the work conditions, critically the work conditions, and dissect the tasks that are to be performed. That's the kind of analysis we have to do. And then we're going to leverage our understanding of human capabilities and the research on that, and we're going to identify the particular steps that are problematic and then hopefully design them out. That needs to be our general approach every time we introduce something into our environment. Most of us do a really good job of this when we buy products off the market. So, when you go buy a car, you test drive it, you sit in the car and you go, oh, this is kind of comfortable, but this rear view mirror doesn't really quite work for me. Let's go check out another car, right? A lot of us are very, very good at doing that when we talk about consumer products for our personal consumption. But when it comes to our work environments, we don't do that quite as well. Or we're okay changing our work processes because the product or the device makes us do that. And that's absolutely the wrong approach, and we'll touch back upon that. So this is a case that I've borrowed from Terry Fairbanks, which he's used on numerous of his talks, and I've sort of introduced a little bit of my angle to this, which is a focus on the cognitive process. So let's think about cardiac arrest for a minute, right, in a defib case. So are there interruptions in this environment? Sometimes. Depends. High workload, would you say? Probably high workload. And fatigue, stress, well, there's absolutely stress, and probably fatigue, depending on when it happens. And one of the techniques we use when it comes to human factors is we do what's called a task analysis. It's a very basic process, and most of us, I think, do this in a lot of other instances. It's breaking down the particular steps that it takes to use a particular device. Okay? So in this case, to use the defib, you have to push the on button, and our goal is to deliver shock. You have to push the on button. It takes about 30 seconds to a minute to kind of charge up and reset and so forth. You select energy, and then you have to take the step of using the up and down arrow to get to your desired level. You have to hit the charge button, which is right here. You hit the shock button right here. And then once you're done, you can push the on button to turn the device off. Is this a good design? Why is it a bad design? Steps, color. This is green, this is red. It's sort of funny, right? There's lots of things there. I'm going to focus on one particular aspect of the errors that I was talking about. So in some of the research that I've done, I say, well, if you're going to make an error when you're using a device like this, so let's say that you just turn the on button and you're going to make an error, where does that error action actually land? Why ask that question? Well, if you can determine where that error action is going to land, you can redesign it to account for that. You get some insight to the way we think about these kinds of devices and the way we mentally represent this device within our heads about how we need to perform. And so that information can be sort of valuable. So when we do that, here's what we get. So this is for all the people where we give them tasks like this and they make an error, where does their error action land? And it turns out that when we do make an error, the majority of the time we repeat the last step we just completed. Okay, so you're doing this task, I interrupt you, you come back. The majority of the time you're going to be pretty successful at getting back. Occasionally you're going to make an error. When you do make an error, 60% of the time those folks are repeating the last action. About 25% of the time you're skipping one action ahead. Okay? Again, this all falls right out of memory. I'm sure people are familiar with primacy and recency. The idea that one of the last thing you did is something you remember, and the last item in a list is also something you remember. The rest of this sort of gets spread out, right? So now that I've provided a little bit about that knowledge, if I say, well, here's the task structure I just showed you, and let's say hypothetically you get interrupted right about here, what's going to happen when you make an error? You're going to push the on button again, which we know turns the system off. And now what happens? You got to wait. You got to wait. That's right. So the consequences are that it's going to power down. It takes a little bit of time to reset. You're blowing about 2 to 3 minutes, all because you accidentally hit the on button again, which, by the way, was green. And so you're kind of rushing, and you're going to sit there, and you're probably going to push that because it's a nice green button. And usually green in our culture means go, and so we're going to do that. So here's my concrete example of how we can apply theory and how we can actually think about tasks and redesign accordingly. So what's the solution? Well, the solution is to anticipate that a repeat action is likely and to design for the error. And so this is directly from Terry's example, which I love, is that if I was to hit the power button on this projector right here, this is what would likely come up. It would say, power off. Are you sure you want to power off? And if you do, press the power key again. So if we know that repeat actions are likely to happen in high-risk situations, why don't we do something like this? Why don't we redesign a little bit? So it's kind of a clear example about how we can start to apply some of the knowledge we have to all these devices in our environment and make that shift. Okay, so I'm going to move on now. So that was sort of part one of we can design to avert errors if we have the right knowledge. Part two here is that we need to start talking about systems in general, and we need to start thinking about how we can actually reduce harm by building more robust systems. So clearly that sort of analysis that I just gave you, we're not going to be able to do it all the time. We're not going to be able to anticipate every single error that's going to occur. And so what we need to do is we need to start thinking about this whole systems approach and start minimizing the consequences of error to reduce harm. Okay? And here's where we're going to go into this this deep dive into a particular type of error called post-completion errors. So remember, I'm warning you ahead of time that we're going way into the weeds here, and it's a test of how well you can stay awake, okay? So pay attention. So the first thing is, let's talk about what post-completion errors actually are. So post-completion errors are a distinct type of skill-based error. And for anyone here that studied psychology, the classic thing to do in psychology is to give a very complex name to the most simple construct you can possibly imagine. And that's because we always get dinged for not being a hard science, and we're competing against physicists that get a lot of money and they do all this true science and they're very quantitative. And so we need to give things hard names. So post-completion error is essentially, and I'm sure everybody in this room has committed a post-completion error before, is failing to complete a step that occurs after the main goal of your task has been accomplished. All right, sort of a mouthful, best illustrated by an example. So let's say your goal is to make a copy at a copy machine. What's the first thing you do? You walk up, you place the original on the glass, you're going to push the copy button, you're going to retrieve your copy document, and in your head you're sitting there going, I'm done, my goal was to make a copy, I have my copy, and what do people often do? They forget to retrieve this original document. And the reason at a task level and a cognitive level that you often forget this particular step is because that was never your goal to begin with. Your goal was to make a copy. This happens afterwards, and it's difficult to remember that step. Not to mention it's hidden under the thing that flaps down, and so there's no visual cue. There's all sorts of problems. So this is that functionally isolated step, and it's tied to a lot of errors in different kinds of tasks. So let me give you a couple everyday examples. Forgetting your gas cap is one. Forgetting the actual hose is another. I promise you that these are not the only two pictures on the internet. There's several pictures on the internet. Forgetting your ATM card at the teller machine is a classic example that used to happen all the time. They've now fixed it, I think I heard somebody say, right? So if we think about redesigning, most ATM machines now, you can either swipe your card, so you have it right away. This is a great example of designing it out. Or it'll dispense your card before you actually retrieve your cash, right? No one's going to forget their cash. So that's one way of getting around it. Now, unfortunately, these types of errors are not just simple annoyances. So again, looking through NTSB reports, in 2005, there was a terrible train accident that occurred. A construction crew had come in for the day. They switched the mainline track. So you just kind of pull this lever and you switch that track. They did their work for the day. Their goal was to do the work for the day. And they're sitting there at the end of the day going, okay, I'm done. I put in all this hard work. And they forgot to return that mainline switch. Classic post-completion error, tragic accident with several deaths. Unfortunately, this step also exists in the CPOE. And this is what I'm going to focus on. So looking at health IT, at the design of these systems, we look at patient order entry systems. There's this log off step. And this is actually one that's very difficult to design out because you naturally have to log off after you're done completing your task, right? So it's a bit of a challenge. So this is one of the things I'm going to focus on here. And one of the approaches that we've used to, and this is very researchy, right? One of the approaches that we've used to try and reduce these errors in health IT systems is to actually predict when people are likely to make these errors. So what we do is we focus on cognitive process, we focus on cognitive theory, we examine people's behavior, and we leverage that in statistical models to predict when someone's likely to make an error. Then if we know they're likely to make an error, we're going to intervene in some fashion and say, excuse me, you're probably going to make an error, let us help you out a little bit. Right? So that's the basic concept. And what we do to get these behavioral indicators is we use what are called eye trackers. Right? So my guess is most people may not be completely familiar with these machines. The idea is that within these computer monitors are optical sensors that can detect your eye movements, and the output that we get from these systems is a simple XY coordinate of the pixel location of where you're looking. Okay? They're used very commonly in psychology, used in marketing to determine where people are looking at ads. So they're fairly common devices on the research side. There have been huge advancements in this technology, so now that you do just have a freestanding monitor that looks exactly like this. So we're going to use these data here, these eye movement data, to predict when errors are going to happen, and that's how we're going to build this robust system. Okay? One example of how we can build a robust system. And here's where we're going to get into all the weeds. So I'm going to talk a little bit about the kinds of cognitive theories that I've been focusing on, and I mentioned some of this briefly. So the idea is that memory is activation-based, and our goals, the way we complete actions, are activation-based. And what that means is that in our head, we have all these different goals, and the goals have particular activation levels associated with them. The one that has the highest activation level is the one that's going to drive our behavior, okay? And you can actually calculate activation. There's a mathematical equation to do it. In laboratory settings, it works quite well. And critically, the activation level of a goal decays over time, right? So if I ask you what you had for dinner 3 days ago, anyone remember what they had for dinner 3 days ago? Unless it was an exceptional meal, you probably don't remember. If I asked you what you had for breakfast, probably comes to mind pretty easily, right? So time is a big factor here. 3 days ago, it's not an important item. You've lost what it is. From this morning, hopefully you still remember that. If not, we have real problems. And so the idea here is that these goals decay over time, and we can leverage that aspect. And then also that all of us, I think, know this, is that environmental cues and internal cues can facilitate our remembering. So if you ever want to remember something, you usually leave a note for yourself, or you'll leave it out in an area where you'll see it, and it'll remember the action that you need to do, right? So I always try and bring my lunch every day. I'll leave my lunch bag out on the counter so that when I'm running out the door in the morning, I see it and I go, oh yeah, I got to bring my lunch. So that's the idea of cues kind of priming us to do particular things. So we're going to leverage some of these principles to try and prevent these post-completion errors, okay? And the last piece here is that when we generally think about doing a task, we sort of load the task instructions in our mind. But with these post-completion errors, the problem is there's this functionally isolated step, and that little extra step gets forgotten, right? We sort of dismiss the instructions after we've completed what we think our goal is. So if we look at this, we have kind of our main goal of making a copy here. You have to place the original on the glass. You push the copy button. You retrieve the copy document. Goal complete. Activation stops. And you're going to likely forget this retrieve original document here, right? So that's kind of the general process. So what we've done is we've worked to actually take all of this information I just told you about and to build it into eye movement measures that we can actually extract. And then what we're going to try and do is take those measures, develop statistical models, embed them back into the computer system, and we're going to predict when errors actually happen in real time. And I'm going to try and show you this, and I promise it's not a magic trick. So one of the key predictors we use are what are called looking at the fixations. So this is essentially where people are looking on the interface, right? So think about where you're gazing. That's one of the data points we're going to use. And the idea is that the more you look around on the interface, well, it sort of suggests that you might be a little bit confused. But really what it suggests is that there's a lot of decay and time passing, and so you're very unlikely to be able to remember the next action on this task. And the other piece is that the location of fixations matters. So I kind of just talked about how you might have particular environmental cues, and you'll look at those to help you jog your memory and retrieve what you want to do. And so if you look in the right areas, that suggests that you're probably on track with the task. And if you're missing particular key areas of the interface, that suggests that you may make an error, okay? And we've run lots of different experiments to do this. I'm going to gloss over some of those details. But the idea is that we run lots of experiments to gather this data and develop the model. We validate the model. We kind of go through the classic science approach, right? Validate the model, retest, and so forth. So here's the actual task that we've used. This was all done on the DoD side. The details of this are completely unimportant. The main thing that we just need to look at is that it's a procedural task, right? It's where people can become experts at this quite quickly. The goal is to fill orders for different types of Navy vessels. Again, don't worry about the details. So you kind of walk through this process of filling in information, but the key thing is that you have to click this process button to complete the order, and then there's this complete contract, which is the post-completion action. So when you click this process button, it gives you a little signal saying, good job, you're done. Not you're done, but good job, here's what you've completed. And you have to remember this extra step. Not unlike remembering to put your gas cap back on your car. Not unlike remembering to get your ATM card back. So this is kind of what we're concerned with. And so if we look at the task structure, here's what it kind of looks like. You have new order, you complete these different widgets, you hit process OK, you get this signal that says goal complete, and then finally we have this complete contract button that needs to be pushed. When we run people through this experiment and we don't interrupt them, they know they need to do this. The error rate, is 1, 2, 3%. When we start to interrupt them, we get this unbelievable error rate of 10 to 15%. It's very difficult for people to remember to do this action. Again, not unlike the examples I just gave you. So this is what we're focusing on in this task. And what we've done is, this is kind of classic psychology stuff. We interrupted people while they're doing the task, or they had to do these simple math problems, and we collected a lot of eye movement data to run through the statistical model. So when we do that, what we did was we created what's called a logistic regression model. I'm sure some people are familiar with logistic regression. And we've entered in these different predictors. And critically, what we can get with logistic regression is we can get the predicted probability that someone's going to make an error based on the predictors that we put in. The ones we focused on were these total fixations and the post-completion fixations. So this total fixations is number of times you're looking around the screen, and the post-completion fixation is, do they look at that button on the interface or not? Okay? If they look at this button, they're unlikely to make the error. There's a lower probability. As they look around the interface more, there's a greater chance that people are going to make this error. So that's our basic model. And if we look at it graphically, this is a little bit of a complex graph, but on the x-axis here we have the total number of fixations, or how many times people are looking around. On the y-axis we have the probability of error, and these two lines show when people look at that action button and get activation from it, a cue, and when they do not. And the critical thing that you see is that when people actually look at the button and there's few fixations, the error rate's really low. The probability of making error is 0.5% or so, and then it quickly climbs. And if they do not look at the button, there's a very high probability of error, and it increases to almost 100% as more time passes. All right, so sort of a little bit complex, but I'm going to show you a demo of it. Critically, what happens is when we have these data, even though we get a predicted probability of error, if you're thinking about building a system, we have to know when we're actually going to intervene, so we have to set a criterion threshold. We've done that mathematically, and that ends up being about 75%, which means when someone's interacting with the system and there's a 75% chance that they make an error, we need to intervene. We need to do something because it's very likely that they're going to commit this error action. And what that boils down to is that if you don't look at the button and you look around 2 or 3 times, we need to do something. If you do look at the button, you get about 11 chances of looking around, and then we need to intervene. Okay? So I'm going to flip to a quick demo of this, and it's super kind of prototypical, super sciencey kind of thing. It's not going to be all that impressive, but you'll get the idea. So what you're going to see is that this blue dot's going to start moving around, and this is actually where folks are looking at on the interface. Okay? So what we've done is we've taken that equation that I just talked about, we've built it into this eye tracking system, and so it's a live system that's going to try and predict this error in real time. So what you're going to see is people are going to look around here, and they're going to come up and they're going to click this process button, and then they're going to get interrupted by this simple math problem. Keep in mind that it's undergraduates doing math, undergraduate psychology students doing math. And then they need to hit this complete contract button. And so the phase where our system's tracking these eye movements and calculating those probabilities on the fly is between this action and this one. And if we hit that 75% threshold, the system should alert the user and hopefully prevent the error. Okay? Okay. So here you see them looking around a bit. So they click that process button. Here's the interruption. And when they come back, they look around, they look at the button, they're a bit confused. We reach a 75% threshold, and we intervene. Okay? So kind of basic, a basic task, but you kind of see what we're doing from the side. So the point here is that we know people are going to make errors. We can leverage everything we know about cognition to try and prevent it, and this is kind of where we get. Okay, so let's look at some data to see whether this actually works. So if we can flip back to the presentation, please. Wrong presentation, I think. But I could maybe talk about this too. I think it's this one right here. So there's the demo. Okay, so the big question is, does it work? So what we did is we had a condition where we have our prediction and prevention. We have a baseline condition with no prediction, and we're able to bring the error rate from 10% down to about 2.5%. So we're getting there, but not quite zero. There's a couple of reasons for that, which I won't get into. I'm happy to talk about that kind of stuff online. Okay? So what we've recently done is we've tried to apply this to a simulated CPOE system. So we've taken that exact equation, haven't tweaked it at all. We're going to push it over to a simulated CPOE that we developed. Here's what that system looks like. So some of this may start to look a little bit familiar. You have to enter in all this information. It's not so indifferent from that Navy task that I showed you. You enter in some information in widgets, and critically, you have to remember to close this record. If you don't close the record, that's the post-completion action. It can be detrimental. That's what we want to predict. So what we did is we took that exact same equation that I showed you, built it into an eye tracking system, had people perform this task, and we're going to see whether we can reduce these error rates. Okay? That's the post-completion action. If we look at the data that we actually care about analyzing, it's from the point that you hit save on the record and then we're going to look at whether you actually close the record or not. That's the error that we're trying to predict. And we ran about 55 participants or so on this, and this is kind of low-level psychology stuff that we don't really care about. The flashing arrow is what we really want to do to intervene to try and prevent this, and we're going to borrow that same 75% criterion. Okay? So does it work? Baseline condition with no error is about 40%. When we use our Q, we're dropping it down to about 15 to 17%. So why is this not at 2.5? There's a lot of good reasons for that. None of this was optimized. We took the equation kind of straight from what we developed with the previous tasks. We plugged it in straight over here. My guess is that if we were to optimize the equation a bit, we could get this down to, under 10%, under 5%. Right? So the idea is that as we think about these new health IT systems coming out, and we think about building robust systems, this is one way we can move. I know this is sort of an extreme example about building robust systems, but hopefully you start to get the idea. Okay, so we're coming out of the weeds now. So everybody that took a nap can wake back up. And so backing up a little bit, the real point I want to get across is that we need to think about this kind of systems approach, right? What are the conditions that we're working with as we interact with our environments, and how can we build these more robust systems? And critically, we need to focus not just on the individuals, but their interactions with the environment. The conditions that occur every single day is what we have to pay attention to. So this is the last little couple slides on how we can actually sort of build our defenses as an organization. And this is where I'm going to try and tie back to a lot of things, the conversation we just had following Paul's talk. So every single one of us generally sees something going on in our environment that maybe is not quite right. So how many times, if you're in this environment, have you said, wow, those two medications with red caps are awfully similar? Right? And there's probably something we could do about it, but I'll just kind of go on. But they're very, very similar. Right? If you look at sort of this design of medication carts and these kinds of medications, I mean, it's incredible to see the kind of stuff that actually happens. And if we actually want to move to making it easy to do the right things, we need to identify all of these scenarios where it's currently not so easy, where it's sort of a little bit of a challenge or something doesn't feel quite right. And the real problem here is that we're all too smart. We're all too adaptive. All of us come into our environments and we say, okay, I need to get my job done. That's what I'm paid to do. That's what I want to do. I want to deliver good care. And so despite the fact that this work environment's not quite right, I'm going to change my behavior to adapt to this particular environment. And that's a great thing to do. It's a great skill to have. It's a great way to succeed. But the problem is that you have to adapt every single time. And you have to remember to adapt every single time. And once you have this sort of perfect storm of external factors, maybe it's interruptions, maybe it's stress, maybe it's fatigue, maybe it's high workload, you might just forget once. Or maybe you're not going to forget, but your colleague might just forget one time. And when that happens, you're going to get these errors. Right? So how do we actually move to alleviate that situation? A lot of it comes down to this patient safety reporting system that Dave's now put in place. This is the way we can get all of this information. And we just had this great conversation about the value of this information, not just because we want to be transparent, which is critically important, but from a researcher side, when I put my research hat on and I say, how can I actually better our environment? I need that data. I need to know what's happening out there. So this is kind of the key thing, is that we need to report these unsafe conditions. We need to report the near misses. We need to report patient harm so that we can better the system, not just because of transparency, which is critically important, but because that's information that we can use to identify where the risky situations are, and we can work to make that all better. So just a quick little story, because I think this is my last slide. So I spent a lot of time working with the Department of Defense, and one of the areas I really worked on was counterinsurgency. So this was kind of at the heart of the Iraq War. Insurgency was a huge problem. And one of the issues the Army was having was that the way traditional warfare worked was that you have this upper echelon of folks that are the intelligence folks, and they kind of send commands down the system. And the folks down below do things, they gather information, and they send it back up the system. But the time it takes you to send information down and to send information back up is way too long. It'll take you days, okay? And in an insurgency environment, in counterinsurgency, that information flow needs to be immediate so that you can actually react and stay on top of the game. And so it was a huge shift for the Army to do this. Lots of money was thrown into technology. And the solution was that Well, if we turn every single soldier into a sensor, and when I say sensor, I'm not even talking about technology sensor, but every single soldier is working in a different environment. They're all very smart, and they see things happening in the environment. If we can collect all of that, and then they can process it, and as an organization we can process it, we can change the way we do warfare. And that was counterinsurgency. It was the idea that this information needs to transfer faster. Everybody's a sensor. And so when I think about us in this reporting system, we're all sensors. We're all seeing something different in our environment. Some of us are going to choose to maybe not report it, but the right thing to do and our responsibility is to report that information so that we can then improve and act on it. And that's what I'm going to end with. So thank you very much for the time.